Here in the mental health profession, we're seeing definitely an increase of not only the number of kids we serve, but the number of kids we serve with increasing problems. And while I think what we've done has been very effective, we have felt that it's been limited. And we want to see more pronounced affirmative outcomes. So because of that, we've expanded what we do here to include these other treatment options. And they are used in conjunction with everything else we're already doing. Our kids also continue to see the psychiatrist. They also continue to receive family treatment. Individual treatment is necessary. But we've just integrated these approaches in. And I think the benefits are that people like that they're non-pharmacological, meaning there are a lot of families that want to treat anxiety, attention deficit disorder, in other conditions that we see or other symptoms that we're seeing without having to go to medication first. So this is a nice option where we will do a full assessment, find what we're dealing with, and then treat that. So all of the protocols are individual. They are based on data that we've collected, and they're in conjunction with what the known diagnosis and symptoms are. The benefits are that we collect data ongoing, not only in terms of how they're progressing through the protocols and the programs that we've designed, but also we do post-assessment. So whatever we've done initially in terms of pre-assessment, at the conjunction or at the conclusion of their treatment, whatever we decided that would be, we reassess. And part of that assessment is not only the actual data from the computerized programs, but also anecdotal data from the families, from the clients themselves, and from more objective and subjective testing measurements such as rating scales. So we'll have pre and post data to look at where the outcomes are. Some of the anecdotal benefits that we've gotten, we've had kids with who've had inconsistent grades for some time. Their grades are better. They're completing work more efficiently and quicker, so they're able to do other things. They feel more in control of what they're doing, and their behaviors have improved. One of our patients I've treated now for about 5 years, and she came with me. She has multiple clinical diagnoses, including Asperger's, ADHD, learning disorder, anxiety, migraines, and her disorders are such that they really manifest physically. So she suffers from a lot from anxiety, which then turns into migraines, which in terms of her ability to go to school, she ended 2 school years on home hospital teaching because she became so sick with headaches, sleep-related problems, immune problems, that she just couldn't go to school. Now, since we started neurofeedback and cognitive training first, and since 9th grade, she's gotten through each of the school years complete. She's now graduated from high school. We added biofeedback in just this year to really treat the migraines and a lot of the anxiety in preparation for her to just continue to manage that stress, which she's done a much better job doing, but she still was suffering a lot from the migraines. So we added the biofeedback in, and she'll continue the biofeedback throughout the summer, and she's scheduled to go to college starting in the fall, and she received a full scholarship, so she'll be attending with a full scholarship, and she'll be getting supports while she's there, and she'll continue to come into the office when she's home.